Well, the U.S. was already battling high childhood obesity numbers before the pandemic. And now with more kids learning from home and all the stress that goes with it, those numbers are sure to go up. Our Sydney Stallworth spoke with experts. She has more.
The World Health Organization says that childhood obesity is one of the most serious public health challenges of the 21st century. And back in 2006, it was described as a pandemic of its own. And of course, now we're in a very different type of pandemic, but there are concerns that even more kids could be at risk.
People losing their jobs, higher stress, maybe not having the ability to cook for themselves or the energy to.
BEKAH DEWITT, owner of Nutrition LLC in Madison, says nutrition for people of all ages and healthy eating habits may be more important now than ever. She advises parents who might be noticing a change in eating habits or weight gain in their kids to make a family-wide effort to reach for healthier options.
It doesn't signal out one particular child that has to be different than all the other kids.
The CDC says obesity impacted around 13.7 million children and adolescents in 2019. And according to a healthieramerica.org, 9.4% of children ages 2 to 5 are considered obese. BEKAH DEWITT has some tips for parents.
What you bring home is what you provide your children. Short-term drastic changes rarely works out for anybody.
And she knows firsthand a change in weight, eating habits, or behavior could be an indicator of other underlying issues.
I have depression myself, and when I have an episode, I have a lack of energy. And so the thought of trying to get up and fix myself a meal is overwhelming to me.
Counselor MONRETTA VEGA is well aware of child obesity too. She says some kids could turn to unhealthy eating habits during the pandemic.
So many changes have occurred for them since March. A lot of this can lead to isolation. It can lead to sad and negative feelings and emotions. It can also lead to some coping through eating.
Psychotherapist MONRETTA VEGA says when seeing any changes in eating or sleep patterns, it might be a good time to check in with your kids and maybe even suggest seeing a counselor. Putting the Valley first, Sydney Stallworth, WZDX News.